Welcome to the Man Cave Podcast with Dan Casper.
He is Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. Good morning, Austin. How we doing lately, man?
Excellent. Beautiful day out there, ready to rock and roll.
Absolutely. So, hey, we get the second half of the baseball season begins today, and one player may not play, we don't know yet, is Sal Frelick, the Brewers right fielder. Now, he was diagnosed, they said, with a grade 1 strain in his hamstring. I know we've talked about kind of like these different grades and such, but, you know, when you see like the MRI and that, what kind of determines whether one's a grade 1, grade 2, or grade 3 when you're looking at that MRI?
Yeah, it's a very subjective thing. So, I mean, you know, when there's certain classifications where we can do measurements or we can do looking for like amount of fibers that are disrupted. For this, it's simply mild, moderate, and severe. So, you know, if you look at it, the radiologist will say, like, that looks like it's a mild one. So what we're looking for is in a muscle belly or sometimes a muscle tendon junction. You basically look for edema, which is inflammation, fluid bleeding, et cetera. So when you see that basically you just say, does that look like there's a little area or a large area? And so it's a very subjective thing. So, you know, just after experience of looking at him, you just say, you know, is that one a mild one? So grade 1 being the lowest grade is very mild. So that tells you that they're going to see some signal. That means some of the fibers tore, but not a lot of them. So it should be a fairly quick recovery, but you know, muscles can be fickle, and as people recover from them, sometimes it's something that either it just takes longer to get back than they think, or occasionally you have a situation where they get recurrence, right? So they start coming back, and then that first time they go in a dead sprint, there they pull up again. So that's the tricky part of these, is that you really want to make sure you get past that window where you're not going to have that recurrence, because once you injure it a second time, even if it is relatively mild, those second rounds always take longer, and of course everyone's always more cautious. So that's what you want to try to avoid.
So what is kind of what would he be kind of doing in the recovery process? Is it just literally just like sitting around and resting the leg and such? Can he do some stretching with that? Does that affect the torn fibers? What's kind of like the rehab process for something like that?
Yeah, and on the first front end, it is a lot of rest, truthfully. You just want to let the muscle begin to heal. And then you start incorporating things like, you know, whether it's going to be, you know, deep tissue massaging, stretching. You want to prevent a lot of scar formation, because it will heal a scar. I mean, when muscle tears, it heals a scar, and that's one of the reasons why people, when they have a bad calf or groin or hammy or whatever muscle you're talking about, they can have it just never quite feels the same, or they're, you know, just that tight feeling. I mean, I had a bad hamstring injury in college, and to this day I can still feel it slightly, and that's just because there's scar tissue in there. So point being, you want to try to avoid that as best you can. You have to balance that, where if you're pushing it too early, you continue to aggravate the injury. So, you know, that's where having a healthcare professional on your side of kind of navigating you through it can make that more seamless. But at the end of the day, it's going to be, again, front end, resting, transitioning into, you know, stretching, and then some muscle activation. Ultimately, you start testing it. So you start with things like jogging, and then sprinting, then, you know, really explosive movements. And if those all go well, then you're back to playing.
Mm-hmm. Yeah. So speaking of kind of like nagging injuries, it seems like Caitlin Clark's kind of going through some of these nagging injuries too. She's got a groin injury right now. She's gone through some quad strains, quad injuries, and such. You know, when you look at some of this, it seems like because she's been missing a couple games here or there, but does a lot of this stuff potentially happen or kind of reoccur because she's returning to the court too quick? And do groin and quad injuries, could those two potentially be related? Why she keeps suffering these?
It's hard to say for sure. I mean, I'd say, can you get compensation in a secondary injury? Yes, you can. I wouldn't say it's classic where we say, oh man, that person pulled a groin, you know, mark it on the calendar, in 2 weeks they're going to hurt their quad. Now, that's not a common thing, but to say that they're not linked, you know, maybe a stretch as well. So, and I also wouldn't say it's like, you know, if it's the same injury, so if it's like she hurt her right quad, she gets back, and a week later the right quad fires up again, yes, then you're saying she's going back too soon. That's what triggered that. But conversely, when you start getting injuries in different spots, it's just kind of like, you know, I say fluke, but just kind of the way it is. And I mean, the good thing is that those aren't serious injuries. They're not going to be ones that you're really worried about being long term. But of course, the timing for them with the All-Star stuff is obviously not ideal, but that's the way life works.
Yeah, exactly. And, that wouldn't have anything to do with, because I know when we talk about groin injuries a lot when we get to football, because we are getting to training camp and such. I mean, would there be any concern for like hernias type of injuries with that, or is this kind of different?
Well, I mean, that's in the differential. So when people have that kind of groin pain, sports hernias are certainly on the differential, meaning it's a possibility. But presumably she's had a pretty good workup by some high-end docs that say, look, this is more of an actual groin injury. And truthfully, the groin injury tends to be further down, right? So the tendon insertion up on the pubic bone, that's going to be where you have that overlap between, is this really an adductor, aka groin injury, or is this a sports hernia? If hers is more standard, quote-unquote, issue with the muscle, then you're going to be talking a little bit further down. So it's kind of easy, because it's only 3-4 inches apart, but on an exam, it's pretty easy to tell the difference between the two.
Mm-hmm. So we are getting set for training camp. I know some teams are already have started, like the Chargers and such, because they got the Hall of Fame game. Others are starting to report here in the next couple of days. But these are going to be times too, Austin, where you got these players who are going to start on the PUP list, these physically unable to perform lists to begin the season. And a lot of it could be because they're still recovering from injuries or off-season surgeries and such too, right? I mean, that's kind of where a lot of this is, so maybe now don't freak out right away if you're a fan and you all of a sudden see somebody's on a PUP list, right? Yep,
absolutely. I mean, there's a lot of people who have procedures in the off-season. I mean, these pro athletes are pushing their bodies to the extreme, and so they get a lot of, quote-unquote cleanup scopes and small procedures that are done to try to kind of optimize them. And, of course, those are generally done during the off-season if at all possible. And that leads to that kind of beginning of the season transition where either they're going to go on a PUP list or they're going to have some limitations where they're not going full go. So yes, very common. We see it a lot. And you just got to see the trajectory they're going. And obviously, new things do pop up and those can be certainly concerning, but to be surprised by some of the names on the list is you just, again, Christian Watson, for example, it's like, all right, he's recovering from his ACL going along as expected, but it's going to be unlikely that he's going to be full bore right out the gates. It's just not the way they're going to do it. Even if he feels great, and I know they've been saying that, they're just going to, especially in a revision setting, they're going to treat him with kid gloves.
So how, like with your guy, J.J. McCarthy, obviously coming back from his knee issues from last year, would there be any type of concerns as we open up training camp and such, or is there anything that you're kind of curious to follow along as preseason and training camp open up for Minnesota?
No, I mean, he's a huge unknown at the quarterback, so beyond that, as far as the knee specific, not really. I mean, meniscal injuries are a little bit unique in that it's pretty black and white. I mean, like it's going to heal or it's not going to heal. So if you look at it and say, okay, did this meniscus heal? And I know there was some controversy in the offseason. He had a second procedure, which turned out to be an injection, which so I think kind of got overblown. He says he feels good. I've seen videos of him moving around. He seems to be moving around well. So it sure looks like that meniscus healed correctly. So it should be like healed and good. And I would bet you my bottom dollar they've had repeat MRI showing exactly that. So they didn't want to do something in the offseason, not during camp. So or certainly the season. So I'm guessing that's going to be going in the right direction. And but that being said, I mean, he certainly had a different off season than most, right? I mean, with his rehabilitation, that was an actual season even. So I mean, he may have to watch some things as far as reps, and you don't want to get into overuse injuries and things like that. They're going to always kind of navigate that with guys coming back from whatever injury, in this case a knee. But you just have to kind of walk that fine line of like, all right, we want to get him acclimated, get him going. And certainly at the quarterback position, there's a lot that goes on in kind of a cerebral end, right? It's a mental game as much as it's physical at that position. So I think they're just going to get him as many reps as possible and do it safely.
I know this might be kind of a weird question, but obviously we've talked about Jacob Mizorowski quite a bit and, just how much power he throws with and that. But, as we begin the second half of the season, say you were advising the Brewers or you were a part of the Brewers training staff because, one of the things we've been talking about has been his innings count. He hasn't, gone over 100 innings throughout any point in his career, and he's approaching that right now as we begin the second half of that season. Is that something that you would be kind of cautious about, advise maybe the Brewers like, hey, let's maybe slow it down a little bit? I mean, because I can't imagine they would take the the complete reins off of him to just go out there and throw as much. Is that something that you think the Brewers are going to monitor as we get into the second half?
I mean, absolutely. I mean, there's zero question on that. So, there's the old expression, it's always better to try to prevent something than treat it. So when it comes to shoulder and elbow issues, which is what you're worried about in the pitcher, right, you want to try to prevent them. So what you don't want to do is push them until you start saying, now my elbow's sore, because then you've already opened Pandora's box. And so what they're going to do is they're going to limit it, and they're going to, whether it's going to be actual outings or innings or pitching, or some combination of those where, because I think they said they are going to sit him in the first series, right? They're going to skip him in the rotation, I think is what I'd heard maybe, or something to that effect. Mm-hmm. And I think they're going to probably do a fair amount of that. And then in addition to that, they'll probably say, all right, we're going to, cap him at X number of pitches or innings. And just because, again, you want to ease that in. And certainly if you look at his frame, he's a tall guy, but he is not exactly burly, right? Mm-hmm. So, you want to probably see him get a little bit stronger in the next couple seasons to build up more stamina and strength, and that will probably lead to an increase in innings pitched. But certainly when you look at his talent level, he is not a guy that you want to see burn out early, right? You harken back to like Strasburg or guys like that just had all the potential in the world and just had injury after injury, right? So it's always something, if you can prevent going down that path, it's way better than trying to treat a problem. So my guess is they're going to keep a real close eye on that, and even at the hint of an issue, they're going to shut him down. And again, it's even better to try to get that before that. So it may be frustrating, and it is, with if you look back to the days of like Nolan Ryan, who, was just an iron horse and could just throw forever. Those days are gone, and he was a unique guy. So, to try to compare people to that, I don't think it's fair. So you look at what he's trying to do as a pitcher, they're going to want to make sure they protect their asset for the long term.
Mm-hmm. To kind of wrap it up here, I'm just kind of curious. Not sure if you've been following along a whole lot with this whole NFL Players Association, NFL drama, secrecy, and stuff. But apparently, an arbitrator in February had ruled in favor of the NFL in a grievance that the NFL Players Association encouraged running backs to, quote, exaggerate injuries to increase leverage during contract disputes. So as a doctor, and this was mostly from my understanding, so running backs wouldn't get like the franchise tag if they were unhappy at their team. They could, quote unquote, fake injuries so they won't get fined, and then the team would move on from them and such. But that's kind of a blanket, general statement there. But as a doctor, when you hear something like that, where exaggerate injuries and fake injuries, that's got to make your job a lot more difficult to help these athletes, I would imagine.
Yeah, so at the end of the day, there are things that we have that are very objective, right? So I can get an X-ray and be like, look, your bone is broken, right? Or you tore your ACL, and I can pull on the ligament and it's lax. So those are things that we can objectively say there's an injury. Other things are subjective. People come in and say, I hurt right here, right? Mm-hmm. We always believe our patients. We don't come in there being like, this guy's lying, right? So you assume they're telling you the truth. And so, absolutely, that makes it a challenge. It's something that we do navigate. Now, it's really interesting, and I think I've touched on this in the past. In essence, NFL players, when they have an injury, it's a work comp injury. That's what it is, right? So their job is playing in the NFL and their injury, so it's a work comp claim. And so we do deal with that in kind of the normal public health when people have injuries that are work-related, and there's always that concern that there's some kind of malingering or secondary gain. So it is something you have to be aware of. But even though, we always try to take people at face value with what they're saying, but there are some times where things don't always add up. And but in that same token, people can have pain and we get an MRI and it looks normal. You don't come in the room and say you're a liar, right? It's just things don't always add up exactly. So if you have a situation where people are exaggerating or being frankly untruthful about their complaints, that makes it very difficult as a physician to treat them appropriately, because in that circumstance, you're treating an imaginary condition, so it's kind of hard to make them better if they weren't bad to begin with, or at least maybe exaggerating. So I'm sure that's going to be a concern, but I can tell you the team physicians are going to do what they do always, which is going to believe people, treat it appropriately, and that's just something that's going to be have to be figured out in the courtroom as far as how they navigate that. But it's a tough situation when you have that issue where people are doing things for financial gain. It kind of puts you in the middle as the physician, but we always advocate for our patients, and that's kind of the side that we have to take.
Mm-hmm. And kids, don't fake being sick to miss school. That's that right there too. So
rubbing the thermometer on the carpet to heat it up.
Yep. Oh,
I've never did that as a kid.
Me neither, man. Never. So, Austin, dude, appreciate the time as always, man. Enjoy the weekends, and we'll catch up with you again soon. Okay, bud?
Absolutely. Have a great one.